Hola Mexico City expats. In video 9, we'll be discussing hospitals, medical recommendations, food and water precautions, pollution, and some general advice for expats traveling into Mexico City. The medical and environmental. According to the Overseas Security Advisory Council, these are some top hospitals and clinics to contact while in Mexico City. There's the ABC Hospital, which is the Observatorio, the ABC Hospital in Santa Fe, and then the Hospital Español. The medical recommendations for all expats that are traveling from North America to Mexico City. Before traveling from the United States to Mexico City, expats should visit their personal physician 4 to 8 weeks before their departure. These healthcare professionals can advise you on the exact immunizations needed before your departure. Some food and water precautions. Do not drink tap water unless it's been boiled, filtered, or chemically disinfected. Do not drink unbottled beverages or drinks with ice. Do not eat fruit or vegetables unless they've been peeled or cooked. Avoid cooked foods that have been sitting for long periods of time. Cooked foods that have been left out at room temperature are particularly hazardous. Avoid unpasteurized milk and any products that might use unpasteurized milk, such as ice cream. Avoid food and beverages that are obtained from street vendors. Do not eat raw or uncooked meat or fish, including ceviche. Some types of fish that contain poisonous biotoxins that contain the biotoxins even when they're cooked. Barracuda in particular should never be eaten. Other fish that contain toxins include red snapper, grouper, amberjack, sea bass, and a large number of tropical and reef fish. This is some general advice on expats, or for expats, I should say. Bring some adequate supplies and all medications in their original container and that they're clearly labeled. Carry a signed, dated letter from a primary physician describing all medical conditions and listing all medical medications, including generic names. Pack all medications in the hand luggage and carry a duplicate supply in your checked baggage. If you wear glasses or contacts, bring an extra pair. If you had significant allergies and a chronic medical condition, wear a medical alert bracelet. Make sure your health insurance covers you and any medical expenses abroad. If not, a supplemental insurance for overseas coverage, including a possible evacuation, should be seriously considered. If an illness occurs abroad, medical expenses, including the evacuation, may run to tens of thousands of dollars. Before departure, determine whether your insurance plan will make payments directly to the providers or reimburse you later for overseas health expenditures. Medicare and Medicaid services do not pay for any medical expenses outside the United States. Make sure you pack a personal medical kit customized for your trip. Take appropriate measures to prevent motion sickness and jet lag. On long flights, make sure you walk around the cabin, make sure your leg muscles move periodically, and drink plenty of fluids to prevent blood clots in the legs. Let's see. When you're traveling around the city, make sure you avoid any contact with stray dogs and other animals. If an animal does bite you, make sure you clean the wound with a large amount of soap and water and contact local health authorities immediately. Make sure to use sunblock regularly when needed and use condoms for any and all sexual encounters. Ride only in motor vehicles with seatbelts and do not ride on any motorcycles. Mexico City does have a pollution problem though. Air pollution reached unacceptable levels in Mexico City in 1998 due to a smoke from forest fires in southern Mexico and low rainfall. Pollution is typically most severe from December to May. Travelers with respiratory and cardiac conditions and those who are elderly and extremely young are at the greatest chance for complication from the air pollution. Their complications may include cough, difficulty breathing, wheezing, and chest pain. The risk may be minimized from staying indoors, avoiding outdoor exercise, and drinking plenty of fluids. And that concludes our section on the pretty much general advice for expats traveling into the city. And thanks for watching, and remember, any questions or concerns can be answered through the hyperlinks in the description.